Welcome to the Total CEO. I'm Sharon Kuhn, and my co-host today is Dr. Peter Reich. Today, we're honored to welcome Dr. Josh Howard, a clinical preceptor, lecturer, mentor, and leader in digital dental education. Dr. Josh is passionate about helping shape the next generation of dental professionals. Dr. Howard, we're delighted to have you with us. And to get us started, tell us a little bit about your journey and what led you from private practice into dental education.
All right. Well, Sharon, thank you so much for having me today. I'm honored to be here. And, Dr. Peter, really great to see you again. And I'm really looking forward to the discussion. I think for me, my journey was a pretty long one as far as kind of how I got into it. For me, it started with my father. He was the dentist in Dover. And coming from Dover, New Hampshire, I grew up in that office. I would see him with patients. I would see how he was and see how he interacted with people. And he was a happy person. I really felt like he enjoyed what he was doing, and I kind of gravitated towards that. And so I decided to follow in my father's footsteps and become a dentist as well. And over time, I think that I really gained an appreciation for learning how to work with people. And that's one of the things that my father would say to me when I would hang out at the office. He'd say, "You're actually pretty good with talking with people. That's a great trait to have, and it's not an easy one to teach. So, you should probably do this." And I've he's been a great mentor to me throughout my practice, and I've had some really, really great consultants, people like yourself, Sharon, that have really shaped my journey and put me on the right path to being a great clinician and understanding how to work with people and not even just patients, how to work with my team. And communication, as we know, is such a huge, huge part of that.
Yes.
And I mean, for me, everything was great. We grew the practice, we got associates, the team was great. Um, And then as time went on, we decided to transition to Florida. And so I was commuting back and forth. I had a good number of associates. I think we're up to five at our biggest. And everything seemed to be fine. I was in more of a managerial role, a mentorship role, and I had several of my associates who kind of moved on, who stayed friendly with me and had said, "Hey, you know what, Josh, you were a great teacher. You were a really great mentor." And that started me thinking, hey, maybe I should teach. Maybe that would be a good idea for me. And then COVID happened. Okay. I mean, like a lot of people, that changed my life. But it was, for me, a really, really great way to experience burnout because I had talked about it. We all knew about it, but I lived through that. And that is what changed me, is that I got so stressed out and I had coping mechanisms and I was trying to do certain things to try to manage it. But at the end of the day, during this process, I feel like I lost my way. I lost a lot of what had really made me the kind of clinician that I liked to be. I stopped looking forward to coming to work and all that. And I experienced a lot of those negative emotions and going to very dark places. And I said, okay, this is it. This is the signal that I need a change. And so after some time, sold the practice, and then decided after a little bit of soul searching, maybe about 4 months, that you know what, teaching is for me. And I got a position at Lecom Dental School in Bradenton. It's been a really great experience, and that's kind of how I think I ended up as a general dentist for 20 years, and then transitioning into being a dental professor instead.
Excellent. I appreciate learning about that. Dr. Howard, Dr. Pete and I have talked so much about the emotional intelligence part of, being in practice and being a dentist and that people work that you talk about. And in my world, helping executives understand that the stress isn't just in their head. It's a psychobiological thing. So we are chemical people. And emotional intelligence means that we're actually aware of sort of this chemical soup going on in our body that our body's noticing that we're psychologically safe or not psychologically safe, with the interactions that we're having with other people or missing having with other people, you know, to define emotional intelligence, to bring that into our conversation today. Because what Dr. Reich, Dr. Peter, and I have been working on is knowing that the dental student deserves to know how to self-regulate before they're in a practice that is so intense, that managing their own stress can be a number one job, you know, so that they can walk into that room and be their whole self with their patient and bring that amazing practice and clinical excellence that they've been working on. So, emotional intelligence is the ability to understand the emotional signals in one's own self and in others, kind of read the room, pick up on rapport, pick up on new, you know, the nuances that are going on. And that's going to be more unconscious than conscious. You know, when we're learning to drive a car, we have to think really hard to turn on the, you know, the turn signal and to be sure the whatever, you know, and to step on the brake and how to take a turn fast or slow. But once we're good at it, we would never know how many times we stepped on the gas to get to work. We would never know how many times we tapped that pedal, the brake pedal to get to work. And that's the way it is with emotional intelligence. If people aren't skilled in these soft skills, but we give them framework to help them understand those nuances that they're reading or not reading, the more we understand more we have language for that unconscious framework, the more we put it to work for ourselves, and the more we hone it, and even the more unconscious it is, like driving a car. Communicating with our staff and our patients is a lot like driving through traffic. Okay, there's this traffic, there are these tensions that we share that are very important. And so as we pick up on those stop signs and we pick up on those yellow, you know, yellow lights and red lights and green lights, what we do is we make these wonderful intersections with our patients. And just to define empathy, empathy is the ability to identify with someone else's feelings and emotions, but we don't want to lose touch with our own. And that's where Dr. Peter and I want to bring that self-regulation into dentistry. If we're hypersensitive, we're going to pick up so much on patients that we're not going to be able to, you know, maintain our own self-regulation. If we don't pick up on patients, they're not going to be felt, seen, and heard, and we're not going to have that bonding trust. So as we go into more conversations, let's remember that's what we're talking about. What you and Dr. Pete, and what I've always appreciated with you, Dr. Reich, Dr. Peter, is that your sensitivity to people is your genius. And years ago, you wouldn't have known how to hone that, how to lean into it as much as you do now. And that's what we want to bring across to students, correct?
Correct. Yeah. Thank you, Sharon. You're always so complimentary. Um, and Dr. Howard, it's such a pleasure to have you here. I've known Dr. Howard 25 years. It's a long time, and I truly believe he's one of the most emotionally intelligent people I know. And you'll see this just when he speaks, but when he's in a room, he reads his patients so well. So I'm very excited to hear what you have to say about the dental schools, the education that students are currently being exposed to, and their level of emotional intelligence in a world where we've got much more technology, IT, social media, AI coming. And Josh also happens to be probably the smartest guy I know with dental IT tech. He could write books on this stuff. So it's so exciting. Emotional intelligence, that's the new kind of research phrase. That's what we're seeing in all the papers, in my literature, the dental literature. And the schools are really giving this, it's just due finally. I never got exposed to this, um, but it seems to be coming out slowly now. So just to follow up on this emotional intelligence, empathy, understanding with the patients, Dr. Howard, how I have a question. We'll start with just a simple question. How important has it been in your career to feel connected with your patients? Do you feel that's something that you learned early on? You alluded to you learned a lot of that from your father. Do you think some of that came innately, or did possibly some of that come in dental school?
I don't think, honestly, Dr. Reich, not a lot of it happened in dental school. And I think that's the problem you see here. And it's something
Yeah.
we are seeing evolve a little bit, but I still see a lot more growth in this area is so needed, so desperately needed. But to get back to your question about, where this connection, the importance of connection with patients and how I developed into that, I think some of it was innately. And, in the past, I always felt, and I think I was incorrect, that you've got a good chairside or bedside manner or you don't. Some people have it and some people don't. And you could teach for skill, but you can't teach personality. And even when I'd
Right.
interview associates, I would be looking 80% for the feels, as the kids say these days, the feels. Like, how do I get the warm and fuzzies? Are they great communicators? Do they make good eye contact? How are they around other people that they don't know? But and then 20%, 80% that, 20%, are they skilled?
Mm,
But for me personally, as far as my journey with getting more comfortable talking to people, my father was always really good at that. He would listen to me from the
hmm.
other operatory, and if I said things in a way that weren't the way he liked to
Yeah.
hear it,
Yeah.
he would, sit me down and say, Josh, I heard you talk to that patient about that crown. Maybe you should approach it this way. Or I know that patient was uncomfortable after the last
Hmm.
procedure, and you asked this and you said this. Maybe you should consider saying this. He always had a very constructive way of doing that.
Hmm.
And uh, over time, I learned it. And I took a lot of continuing ed on communication, and partly that was my first consultant, Charles. And he
Mm,
said, I'm skilled. I've got great hand skills and I could be amazing. But he said where he saw opportunities for growth in me was was my confidence and my ability to communicate, because that was lacking. I really
mm,
didn't know how to talk to people. I didn't really, really learn it in dental school. I learned a little bit of it in my residency in Philadelphia in an AEGD program from Temple University, but it really just took time. But for me, it was all about being genuine. If I could really talk to my patients and talk to my team in a way that they believe that they are important to me, they are a family member of mine, they are a friend of mine. Not just talking points about weather or sports or whatever, but just really like, Bob, how's your daughter doing? I remember, because and we would make notes in the chart about, oh, Bob's got this and this going on, and so don't forget to ask about that. That was kind of how our office huddle would operate. It was not just procedurally. It evolved into, let's talk about what interests people and what can we talk about at their oral hygiene appointment, so that we could continuing building that trust, building that bond, and building the connections that we live or die by. And like you're saying, it is probably the most important thing, because I know that, Sharon, I know you say this all the time, right? I mean, if people don't remember what you say to them, but they always know how you made them feel. And
yeah.
if you can touch somebody, whether it's a dental student or whether it's a patient or whether it's a team member, if you can make them feel special genuinely, then it makes a huge, huge difference. And it really took me through my whole practice.
That's
Yeah.
so grateful.
Yeah. I mean, it's amazing. You hit on a bunch of things that and items that Sharon and I discuss all the time. Being genuine, family, treat them like it's a family member. That gets you into that genuine feel or mode with them. Your father sounds like he was a great mentor. We're always talking about mentors, but in the beginning, everyone needs it. Even someone who innately has it, like you, Josh. You did hit on some points where in the beginning you may not have the confidence or the feel that you do have. And then ultimately, yeah, these connections really are what are going to sustain us in a practice. That connection you have with the patient, Sharon can expound on this, but the oxytocin that's being released in your brain, like your body feels that. It feels good. Your patients are feeling that. So now you're doing this friendly dance instead of the stressful walk on the plank where you have to, because it's stressful. Dentistry is stressful, right? All the stuff that we do, the patients are stressed. They may be in pain. Um, yeah, that's excellent. I'm just going to follow up with a follow-up question to that, and then I want to hear some more on oxytocin from Sharon because she's so eloquent with that. Um, Josh, would you say it's difficult to find time to connect in a busy practice outside of dental school when you need to stay productive? You're trying to earn money for the practice, trying to earn a living. Do you find that there's pressures to move things along, and how did you cope with that?
Oh, absolutely. I mean, in my introduction, I talked about how I had this big moment where I said, I have had enough and I sold my practice. But
Yeah,
there was a transition there, right? I didn't just sell my practice, I sold it to, are you ready? A
yeah,
corporation. Dun, 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 right? So I sold it to a corporation, imagining how great it might be. And of course, like a lot of corporations, there is time pressure, right? There's time pressure, there's efficiency pressure, there's disagreements on material usage, on how to manage teams. There's a lot of that. And I think that's what I see really, that's really grown in dentistry. So I talk to students about this all the time is that I wanted to not feel rushed. I wanted to not feel pressured because I don't want my patients to feel that. And I tend to put patients into the DISC categories, if that's familiar with the audience, the DISC, direct, influence, steady, and conscientious. And
mhm,
whether it's team members or whether it's patients, I try to mirror their communication style. So if we take the conscientious personality style of the patient, they want all the detail, right? They're detail oriented. If you're going to tell them they need an extraction, they want to know exactly what elevator you're going to use, right, Dr. Peter?
yeah,
And they want to know what kind of suture you're going to use, how many stitches it's going to be. They want to know all the detail. And so you have to have the time to do that. And I have found this, and again, maybe this is just my own perception, but
yeah,
the faster in your mind that you want to go, especially with a conscientious person, the more they want to slow you down. And so, well,
yeah,
hold on, doc. Wait a minute. I have one more question. And
mm,
so I
mm,
find if I can identify those patients early, all of us, and just book me extra time. I realize those are going to be less productive appointments, but you know what? Way more productive for my sanity. And
yeah,
the patient feels so heard. And I'll tell you, I feel like those are the patients we have the most impact with, especially compared to other providers, right? Because when you talk about emotional intelligence among general dentists, and this is what I tell my students, if you could set yourself apart as a listener, as somebody that prioritizes giving the patients what they need. And if it's a direct person, a D, they just give it to me straight, doc. Good, you give it to them straight. Don't tell them a story. That's for the eyes. If they're conscientious, give them the detail. If you could be good at that, at giving people the amount of information that they want, they're going to feel so much more trusting and comfortable with you. And that brings my stress level down. And, getting back to kind of our original practice philosophy, if you just give people what they need and they feel like part of your dental family, they will send their friends and family, right? It's that internal referral base and they will keep coming back for more. Your skill got them into the chair, right? But it's your ability to have that empathy and to see them for who they are, which keeps them there. And I
mm,
think that's really today how we build a practice, especially like we talk about AI. That's what's changing, right? We have all these great computerized tools and ways that we can be better clinicians.
mm.
But we're going to set ourselves apart if we could be better listeners and communicators. That's what I'm thinking.
That
absolutely.
that's beautiful. And AI has no empathy, right? Like literally, that's
I mean,
probably its
it,
biggest downfall right now.
it is, and it's pretty fake. And I work with a lot of large language models. I do a lot of work and I lecture on AI and dentistry to the students. Um, AI, there's so many different arms of it. It's like an octopus. But if we're talking about this fake humanoid algorithm called large language models like ChatGPT and Claude and and all the others like DeepSeek, they are getting good at faking it. But at the end of the day, it's just a computerized algorithm. You give it X sentence and it says, you probably want to be hearing this. That's how they work. Now, you could argue that we're organic computers and we're the most powerful organic computer ever. And we're doing algorithms on our head to give the appropriate response. And that's what we're learning is how to give a better response. Okay. But it's genuine when it comes from a human being because we have prosody, we have facial expression, we have eye contact, we're real and we're warm and we're like them. And that's something that AI will never have, no matter how good of a tool it becomes. And I'm such a geek. I'm a super AI geek. I literally use AI. Everyone in my family, if we had a dog, my dog would be using AI. I love it, but it's a tool. It's not the rule. And I tell my students this: do not trust the shades, do not trust the designs, do not trust the diagnosis on the x-rays. It's there for you. You're still the doctor.
Okay, and I know this is going a little bit off the beaten path. I'm going to follow this just for a second, and then I want Sharon to get us back on with oxytocin. But the AI, I think our generation, just like you said, is going to scroll past AI because we don't trust it. It's got no empathy. But what about our grandchildren? Are they going to be the generation that just accepts it as this is how it is? What are your feelings on that?
Wow. I mean,
Because
I
you know
tend to
the
think,
software better than anyone I know. Yeah.
yeah. I mean, you know what, Peter? It's changing so fast. I have trouble keeping up with it. And where I thought we would be today, I thought it would take longer to get
Right.
here.
Right.
Like, I mean, it's amazing. People are using this for therapy. People are using it as their relationship. It's really happening. And
Yeah.
so you think about, well, okay, so my kids know what's up. And I'll tell you, it's really funny because, we can make songs with AI, but, my kids think it's AI slop. They think it's garbage. They trust it less than we do, to be honest with you. My son, who works for a very prominent AI company, doesn't trust AI.
Oh,
And
that's
he,
that's
as a
fascinating.
software engineer, does
Uh,
not trust it to use it,
wow.
and sh- he should think about it. But the thing is he knows what it really can do and he knows its limitations. So
Yeah.
what's going to happen with our grandkids? Oh my goodness, how much could it change?
I
It's either going
love
to be
this
great
part.
or not.
I
Yeah.
love this juncture, guys. Everything you're saying is so perfect for this podcast because we can connect this transgenerational or intergenerational component. So, I love to say, because it's biologically true, if we bond well, we learn well, we work well. Now, discernment is going to be in that lineup. So, if you're my grandfather and I'm bonded with you, my brain is actually getting the oxytocin, okay, to tell my whole brain how to work together and my body how to work together. Now, it's fascinating because when people empathize, and you mentioned mirroring, and we've talked about mentoring, right? When we're mentoring not from a cognitive place and not just a performative place, but a loving place. I don't know if you're familiar with Marcus Buckingham. He has written Love and Work. When he was with Gallup, he could see all the years, right, that love mattered in the work. And if people didn't love their work and love their people as they loved their work, the retention was going to go down. It was just going to be a mess. The work of Dr. Paul Zak, he calls oxytocin the moral molecule. What I like to bring into the conversation, which I believe is a missing component in most conversations, is attachment. So let's just call it engagement, the deepest human engagement, the reading of one another. So babies love to look at our eyes and feel valued and felt and seen and heard. And that is what we really need at every age. And so what that does is give chemicals to the brain so that the whole brain works together. So I am 4 years old, I'm 10 years old, I'm 15, I'm 20, I'm 25. And my brain with oxytocin spots something that's not authentic and real. And I trust myself more. That has to happen in the early bonding. And that's what we need to get the word out about is our young students are also going to be the young parents, and they need to see us giving them the experience of being felt, seen, and heard so that their brain organizes. It's literally above our right eyebrow here is the PFC, that prefrontal cortex on the right side, right? That is literally by neuroscientists called the identity center of the brain. And that's the part of the brain that helps the whole brain work together. So I'm not just performing out of fear. I'm not just performing to get something. I'm relating. I've been related to, and I can relate to others. So
Mm.
if relationship and relational effectiveness isn't embodied, then that's something we can actually teach people and help them understand themselves enough in order to be present with their clinical and technical excellence in clinical practice with their patient. Is that
Yeah,
making sense? Am I touching on enough things here, Dr. Reish?
it does. And that gives me hope that the human race will continue this bonding and AI will stay in our toolbox is what I'm
I love
hoping
it.
and hearing.
Yes, to actually express, learn, grow, develop, have a growth mindset, and not just go to AI as a shortcut for thinking, because if we don't do hard things in our own thinking, we're not actually practicing our own humanity. We're really just dumbing down. And so that is the fear. And that is where, yeah, the transgenerational piece is huge.
Yeah, it's beautiful. I mean, and then going back to the students with this, Dr. Howard, do you feel the students are understanding the importance of this connection with patients? Could you
Mhm.
put a percentage on how many of them get it and how many don't?
That's such a great question, Dr. Peter. And it's so hard because every class is a little different. And this generation, maybe because of short form videos or, the media they're exposed to, they don't necessarily look at things the way that we do. So in a class of, let's say, 100 students, I think we're up to 130 or 150 actually at LECOM, there's going to be a good percentage, let's say 30% are the drivens. Okay, they want to be perfectionists. They're in competition. Maybe they want to be an oral surgeon or an
Mhm.
orthodontist. So
Yep.
they have something to prove for that. And for me, as their preceptor, because we as preceptors meet with each student one on one and tell them how they're doing, which is not
Mm.
just a numbers game, because it's traditionally
Yeah.
it's been you've done X procedures, but it's also how are you doing chairside? How are you doing with your patients? How are you good at managing your roster, as we call it? But it's really, when we say managing roster, we're talking about how are you getting your patients in and talking to them and building value for the care that they do need.
Hmm.
We're seeing that. So you've got those people who are I just want to do as many procedures as I can because I need to be better than everybody else. I feel like those are the hardest ones to actually reach because they're into the numbers game.
Right.
And medical school is not gonna, and orthodontics, they're not gonna measure me on how great I connect with my patients. They want to know you know, how many surgical procedures I assisted on. And that's their
Right.
mindset. And so I'm trying
Right.
to, that's a challenge. But the majority of the dental students, I think maybe due to technology and an evolving dental training, because now we're starting to train more like dentists actually practice outside, which I know sounds like a foreign concept, but those of us that have gone through a dental education know there's a lot of theory, there's a lot of laboratory work, there's a lot of typodont work, there's a lot of things you do that aren't real. It's an
Right.
exercise in how to follow directions or how can
Exactly.
we train your hand skills. Now that's become a little bit more streamlined so we can focus more on the warm and the fuzzies, and how can we talk to patients about the needed care. I wish there was more of it. There should be more of it, but at least now I feel like we're starting to see it. And those of us that precept, we have a morning huddle, and that's
Mhm.
our opportunity, just like in a general dental practice or a specialty practice, go through the schedule and talk about what's happening that day. But then there's also usually time for a special topic, and that's at the discretion of the faculty member. And a lot of times for me, if I'm not talking about digital dentistry topics, I'm talking about how can we talk to our patients about the care that they need in a way that makes them feel heard. How do we listen better, and how do we relate more and build trust? Those are the things that I focus on. But as far as what percentage of the class, is really engaged, I would say it's probably about 50 to 70%, depending on the year. Really seem to
Okay.
me that they're
Yeah.
that they're really they want to do it. And what I've seen, and I will tell you this, so that I've definitely seen, is there's a greater trend to dental students having experience in the dental field. Like I had it just working in my father's office. I've
Yeah.
assisted him and things like that. But now it's like everybody that I would interview, we would do for a while. I was helping out with the second level interviews at the dental school. They all have so much dental experience. They've all worked in a dental office for the most part. If they're sitting there, it's like the new bar, right? So
Yeah,
if you've already worked chairside, you
that
know
helps a
what's up,
lot.
you know?
That's
Because I'll tell you,
fascinating.
I had, sorry, Peter, what were you saying?
Oh yeah, no, I was just going to say that's fascinating because that's not something Sharon and I have touched on. That's kind of a new concept, but that would seem to me to be essential training. And then I'm sorry, I cut you off. You were about to say something else.
Just that I think
You
that
experienced.
yeah, with dental students, they really, if they come into the school having some background, it's extraordinarily helpful because they've seen the way the communication style theoretically should be. Granted, everybody's different, right? I mean, I think that that's the great differentiator between a good practice and a great practice is how the communication style is, but and how the buy-in is.
Yeah.
So, that's important.
Do you feel that that education that the students are getting on emotional intelligence, like the disc you discussed, is that built into the program, or is that more up to each kind of mentor like you individually?
Now, I have not been around the block a lot to modern dental schools. I work at one dental school, Lee Common Bradenton, and it's a
Yep.
great dental school. And they have a very unique model. The way that the model is, and this was designed by our sponsors, which are osteopathic physicians, is that every preceptor runs a clinic. Okay, clinic is, let's say, 10 to 13 students, and you run it as the senior dentist, and
Hmm.
your students are your associates. And so that model is really all about monitoring them and sharing your personal experience. So, like I said, it's up to each individual preceptor what they want to talk about. And the
Yeah.
stories
Okay.
run the gamut. So it's the quality is all over the place. And I mean, I've received feedback from students that like, oh, Dr. Howard, we love when you come in and you tell us, you know, all of this about communication and, not how to basically not get sued and
Hmm.
build trust with the patient and not cowboy off and do these things. Sometimes the other professors, and this is, I think, a challenge with our model is that it's really left up to the luck of the draw, whoever happens
Okay.
to be in the clinic on that day, with the idea that if we all rotate around and all go to all the clinics, they all get a sampling of all of us, and so they
Hmm.
get a well-rounded education. That's the theory, at least. I think it needs to be tweaked a little bit over time.
Yeah.
And I'm hearing leadership there. And the Total CEO is the name of this podcast. The CEO stands for connect, empathize, and optimize. That's a lot of leadership that we're hearing that is taken on, right? How would that degree of leadership um, be a different type of stress than when you were in school, Dr. Josh?
You
The
mean
stress,
the
yeah, and the
approach
stress.
that I see versus the approach that I experienced as a student myself, like how that
Yeah,
changed?
is that a good question? Because I'm hearing that they're taking in so much, right, in a world that is at a different pace, and they're trying to find themselves. And in the model that I've designed, it's called Your Interior Design, and I like to help people understand 10 different levels of how they react to stress, how they find joy, how they use their intelligences, how they process, how they do conflict, how they, all these different things that are super customizable on how they understand themselves because we are in such a stressful, fast-paced world. This ability to self-regulate is more important than ever before. So to be a leader where we're trying to learn how to literally run business, understand self and others, and do technical work that is truly changing the quality of life of that person we're with. I can't even imagine more intensity. So I don't know if I'm asking my question in a way that really segues very well, but that's kind of what I'm hearing. It's like this leadership piece and the stress piece is a little mind-blowing.
No, Sharon, you're spot on with that because the students come in and the model that LECOM uses is in Bradenton, Florida, we have years 1, 2, and 3. And then year 4, they actually go to two different externship sites. One is in Erie, Pennsylvania. The other is in Defuniak Springs, which is in the panhandle of Florida. So they split the class and they get their fourth year. So what I could tell you about year three is such a critical year because they have done some patient procedures in years one and two, but very, very minor, more observational. Maybe they've done some dental cleanings, but now that they're in year three, and this is when we get to them, we're the clinical preceptors, they have to make this huge jump from preclinical, theoretical to the real human animal and all the variables that go along with it and understand how to talk to a person because they worked on type it on in a mannequin head. You know what I
Mhm.
mean? And right. And be effective and manage it's so much. And what I have noticed in my students is the ones that do have trouble and are stressing out, I feel them pull back. They shut down. We
Mhm.
talk about roster management, they stop calling their patients.
Mhm.
And all of a sudden they've got nothing to do. And so, so you know, Bob, what are you doing today? I see that you don't have anything on your schedule. Well, I don't really have anything. So are you assisting or how are you doing on your procedures? Do you need, so we try to identify, and you talk about mentorship. We try to identify early and help them. If we
Mhm.
can't teach, we teach, so we lecture to them, but then we try to also chairside demonstrate proper protocols and body language and communication styles. But if a student is getting so stressed out that they just are shutting down or they're just asking us, I get this a lot, Dr. Howard, can you just do this procedure for me? Because can you just demonstrate each step for me? And I have to at some point say, are you why? Don't you, this is your opportunity. This is your education. And
Yeah.
so I think identifying that as a challenge. And so with so
Mhm.
many students to mentor all of them is definitely a challenge.
Mhm. Mhm.
Yeah, and that ties into Sharon, like what a lot of what Sharon and I have talked about is this is a twofold experience. There's the patient and there's the doc. In this case, the patient and the student and a mentor, possibly. But it's about keeping not just long-term health intact by teaching them how to relate, but mental health in general for the dental student. It is incredibly difficult. Like I've relayed some of these stories to Sharon, just like you did, and they've got the stress of their the finances of their education, their grades, um, while at the same time being thrown into treating a live patient for the first time, and there is a lot going on. So if you if you could create a top 10 or a top 3 wish list of things that you think would help these students, Dr. Howard, what do you think? What do you think the most important things to alleviate the stress or teach them some tools to get through dental school and then in private practice?
Honestly, the number one thing I would mention to them is what's really worked for me, which is mindfulness meditation. I think when I identify somebody who's really stressing out, like, and we know how to recognize that. We pull them aside and we say, "Hey, are you getting out? Do you have any interest outside of dentistry? Are
Yeah,
you do you have a good support system? Do you have friends, family that you can spend some time with? Sometimes the over engagement, again, especially because so goal oriented. I have two sons who are extremely goal oriented, and I have to tell them constantly, "Hey, it's great. We love it, but maybe do something fun. Don't get
yeah, yeah,
so driven into it because it ratchets up that stress, right? The stress
right.
hormones go crazy." So identifying it, so mindfulness meditation, physical activity, try to get some exercise, try to get some fresh air, try to break it up a little bit, try to have a little bit of fun and get out of this. I am a dentist, I'm a dental student. I have to just push, push, push. It's never enough. I have to keep going hard as I can possibly go. And I see that. And that's what we have to, because you want people to have ambition and you want them to work hard. And it's a tough environment, right? Especially if they want to specialize. But how do you find that balance, right?
Yeah, that's so important because it doesn't lighten up on you when you get out. That's the thing. It's not like, oh, I got through the hard part. The hard part's kind of beginning after, and sometimes they don't realize that. So Sharon always says, their cortisol levels like are going to go through the roof, kind of like you mentioned, and it's not going to do well for their health. So I love what you said, having that outlet, finding that thing that one student can do to alleviate. Um, just having someone to talk to, right? Just literally having someone to go home or on the phone, talk about their day, what they went through, can be immensely helpful.
And I'll often ask someone that I'm going to be talking to, like, do they have strong bonds? Do they, because if they don't have that best friend at work, and we don't mean a
Mm,
best friend where we tell them everything in our life at work, but that best coworker that we can be vulnerable with, that is absolutely huge, having a best friend at work. It's one of the
yeah.
Gallup Q12, major questions that we ask. And then I would love to tie in this part about mindfulness. So, yeah, it's so powerful, but there can be a precursor for some of our students, and that is understanding self and understanding brain. Sometimes it's the science of how their own brain is going to be harmed if they don't know how to do self-care. And that's sort of a back door that is very, very important to some of our high performers. Now, if I'm performing out of a background of deep security, I've got a network, I've got people that are there for me on an emotional level. They get me. I'm felt, seen, and heard. But if I'm performing to prove I'm worthy, friends, that's a whole different type of proving and performing. And there's very little satisfaction ever attached to that. It's going to actually
Mm,
act in the body the same way as an addiction, whether it's an addiction or not. We can be addicted to performance that when it is not attached to, here's the attachment again, when it's not attached and connected to a background or a present network of healthy human connection.
mhm,
So, yeah, knowing how our brain works, knowing how our own self model, our own interior design works, and being in touch with that interior design so that we can bring it into mindfulness, right?
mm,
Working at a behavioral health hospital, and I've mentioned this on another episode, is that it was just fascinating how many of our staff were not aware of the relational component being what the brain is looking for more than the cognitive control. So to cognitively control emotions is not the same as to, emotionally understand and be good with feelings and emotions so that we can read them in other people. Otherwise, we're overriding and dissociating. We're recognizing emotion to dissociate from it and override it, rather than recognizing emotion, knowing what our body's telling us about it, so that we can relate through it. And those are really specific nuances that we can help students understand how to manage their own brain as an organ and then manage their heart as a person. Sometimes I'll
mm.
say this body is like our earth suit that we live in. We're stuck in here, okay? But the identity within is built for relationship, even if the earth suit can default to survival. And it's not good looking when we default to survival. Like you said at the beginning of our podcast, you were in sort of a survival mode during COVID, and you could tell I've got to make a change. And some of our high performing students can make the change of learning self-care.
Yeah, it harkens back to me when you're in dental school, when you're in private practice, you're doing a stressful procedure, something you might be afraid to do. It's so important to like let somebody know that maybe you're nervous about doing this. But the way I used to deal with that is then do it 100 times. And if you just do it, maybe with guidance, let someone know so you're not on your own, like horrified with cortisol going through the roof, but just do it multiple times until you get through it. But even being able to recognize those fears and not be, ashamed to say, hey, this is the first time I've given local, inferior alveolar nerve block, and it scares the heck out of me. Can you watch me do this 10 times, doc? And those 15 students, Dr. Howard, are lucky to have you as their preceptor. I'll tell you, but I hope all the others are just as good
Thank you.
because those are crucial moments. Just for all the reasons you said and the different student types, and some are just trying to get through a checklist. But if you're still just trying to go through that checklist, these people aren't robots, and they're
No.
doing things on other people, and there certainly is stress in that. And to
One of
find
the
an to find an outlet for that stress, I think Dr. Howard brought up and Sharon, you discussed the connection is so important.
Mhm. One of the things that I've seen as well, Sharon and Peter, is that I really encourage the students to try to celebrate every win that they can, because
Hmm.
again, it becomes such a, if I just make it to next year, that's the goal. And then if I just get a job, and then that's the goal. And then so it's, I say, you know what, let's get a little more granular. Let's have a great day today. Let's just have
Yeah,
a great
but
day.
yeah, that's so so good. Because if you can look forward to coming in to work, to school, to whatever, that's a huge win, right? Not like, oh, I got to go do this. Like
Mhm.
Absolutely.
like
Absolutely.
go in, pick some small little thing you're going to win at, right? That's perfect. And don't think about the giant thing down the road, the oral board exam or the buying a
Right.
practice. Like, it'll just all unfold if you're doing it day by day. I like that a lot.
I
Right.
do
Because I mean, you can
too.
always focus on something that's going to be a huge goal, that's going to be stressful, or you could focus on something that, will bring you joy. And
Yeah.
I think we get into this rat race, right? There's always the bigger fish, there's always the next mega challenge. Maybe that's not the right way to look at it. What do you guys think?
Absolutely. I am loving what you're saying because we know in
Yeah.
trauma-informed care and trauma-informed work and in interpersonal neurobiology, meaning how we share feedback loops with people and how that's changing the biology, we know that you're inviting them to be present and celebrate something in the presence can literally shift them from survival mode. When we're working with traumatized populations, they can't think about um the present. They're always thinking about their future, or they can't think about their future. They're stuck in the present. They can't do both. And we want people to, that's a really important sign, is to be able to say to ourselves, am I able to be present and think about tomorrow and next week and next year? And can I remember yesterday and what and how I got to this part of my journey? It's integration. Integration is going to be a number one key when we're looking at helping people be the healthiest version and the next best version of themselves without forgetting the most recent version of themselves and not being too constantly focused on the future version of themselves. This integration and your ability to give them acceptance, which is going to reduce shame and fear, so that their performance is coming from a secure place. And there's the oxytocin, the moral molecule.
Yeah. Yeah. And if it's a student going to school every day and they're afraid of doing something, they need to have the courage to ask for some help to get through that and be watched and mentored more closely until they're not afraid. And then when they're in private practice, I know some dentists who go to a new continuing ed class every month. And that's how they satisfy that fear, is they have someone show them when they're out. The people that aren't asking, for the guidance or aren't recognizing their fear and why they're so stressed, why they can't sleep, right? Like who knows what it is. Those are the ones that we want to try and find early in dental school so that they don't get like that.
Definitely.
Absolutely. And if I could ask a last question, unless I'm jumping ahead too fast, if there was a legacy that you want to leave the world in addition to technical dentistry, what would that legacy look like?
I think honestly, Sharon, that's such a great question. I feel like my students are my legacy, because I really, really wanted to have an impact on the future of dentistry. And I used to lecture in front of people for a company that would sell technology. And I realized very quickly, I'm helping to sell machines to dentists and I'm training them how to use it. But am I really making a difference in dentistry as a profession? And I felt like the answer was no. And so
Right.
now that I teach and I lecture, I precept, I mentor, and I have students tell me, "Hey, Dr. Howard, it was so great working with you and I learned a lot from you." Like that's like it feeds my soul, you know what I mean? It fills my cup. And knowing that, or hopefully for some students, even if it's just one student, they think back to their years after dental school and they say, "Dr. Howard, I remember he taught me XYZ, or he would have been proud of me." Oh my goodness, that to me, that's immortality. That's immortality, because I think of Dr. Bogert, I think of Dr. Bastiani, I think of my mentors in dental school and residency. I think of some of my mentors in private practice early on, including my father, and working with, great clinicians like Dr. Reich. I learned so much from them, and I can now pay it forward. And so I hope my legacy is that I can share some of what I now feel like, what we're all talking about, all this emotional intelligence and empathy and connection and communication, will be the legacy, hopefully for some dental students looking back.
Yeah, and I think identifying that for all dentists and dental students is so important. Is what fills your bucket, right?
Mm,
Sharon, what would it be? What fills your oxytocin or whatever? But it's
absolutely.
so important to identify that, and if they can identify it early, I've had some colleagues where it's the money that fills their bucket, and I think that's a slippery slope. Personally, I feel everybody, all of us, got into this with good intentions, like you said, either helping or teaching. I used to really like, somebody came in with a bad infection. Sounds gross and disgusting, but they're swollen like a softball. And you drain that, you put them to sleep for it, and they come in the next day and the swelling's gone, and they're like the happiest people in the world.
That
Um,
is awesome.
so we
Yeah.
all have our little things. Mine's a little grosser than most, but
Well,
now
mine
it's
would be
TMJ. But
okay. Keep going, keep going. I'm sorry.
no, I was just gonna say now it's TMJ, but they all have something like that, right? Just like Dr. Howard eloquently illustrated right there. If you're getting that fill, you're going to enjoy going to work and doing that, right? And if you ever get to the point where you're starting to not like to go to the office, it's easy to reverse. They got into this for the right reason. They just got to figure out how to turn that ship around and focus on what they really love.
Absolutely. And
You
if we can
know,
help our people know themselves, they're going to hire and create staff around themselves that are truly cohesive and collaborative so that they're always raising the bar on being the next best version of themselves. If we bond well, we learn well, we work well. And without oxytocin, we're learning and performing, but we're sort of a different type of robot and we're not really our full self and we're not really going to impact people for a greater quality of life. And so I don't think it's gross talking about the infection. It's like, no, like we all have these infections and we want
yeah,
to make
right.
infectious
Yeah.
and contagious with the moral molecule. Okay. The human being is born to care, born to have compassion, born to bond. So I have just loved this. Did you want to add something, Peter?
Yeah, I was just going to say this just occurred to me, but because we've talked about mentors over and over again, and you and I do too, Sharon.
Mhm.
And it just hit me that, mentors, if you think about it, the mentors we remember really are the ones who cared, who you could sense that they cared about what they were teaching you, right? But to care about somebody, like some people think, oh, you can't care about a student or you can't care about a colleague. Like you can, and that can come across. And those mentors live with us forever. Like every mentor that pops into my head, I truly felt like they cared. And that's why they stick with you, right?
They
Yeah.
gave you oxytocin. They
Yeah.
ignited that in your brain. And
And then
that,
hopefully
yeah,
they got it back. Yeah.
that's right. Absolutely. I believe that they did. And
Yeah.
I like how you said that earlier, Dr. Josh, is that it's eternal. Is that what you said? Like your students are your eternal legacy.
It's like my path to immortality
Oh,
is to
oh my
be,
goodness, I love it.
remembered as a great listener and a great teacher and somebody who mentored them well.
Absolutely. Well, this
Yeah.
has been fabulous. Thank you so much. Dr. Peter, thank you always for
Thank you,
bringing your
Sharon. This is
expertise
great.
and your colleagues to the table. And Dr. Josh, it has been truly an honor. Thank you. I'd love to have you back. So,
Anytime. That was
Yeah,
fun.
you seriously brought up 10 points we're going to be carrying forward just from this conversation and our presentation.
well, thank you so much. It's been amazing.
Take care.